This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine the human heart is a highly secure, high-tech castle. Inside the walls of this castle are tiny, specialized worker proteins called troponin. Their actual job is to help the heart muscle squeeze and pump blood. Under normal conditions, these little workers stay strictly inside the heart cells. They never leave the castle. But if a major disaster happens, like a blood clot blocking oxygen to the heart, myocardial infarction, the heart cells get damaged and break open. When those cells rupture, troponin spills out into the bloodstream like an emergency distress signal, reading the alarm values. When a patient goes to the hospital with chest pain, doctors run a lab test to count how much troponin is floating in the blood. Because troponin is measured in tiny amounts, nanograms per milliliter, a normal level is practically zero. Low/normal value, less than 0.04 nanograms per milliliter, the castle walls are secure. No major heart damage is actively happening. High/elevated value, 0.5 nanograms per milliliter, or much higher, the cells are breaking open. The higher the number, the more heart muscle is currently being injured. How paramedics use this on long-distance transports. Critical care paramedics often have to move very sick patients in an ambulance or helicopter from a small rural hospital to a huge city hospital that has a specialized heart center. These trips can take hours. During a long-distance transport, knowing the troponin value gives paramedics a massive advantage. 1. Tracking the trend. Is the fire growing? Troponin levels don't instantly max out. They rise over several hours after an injury starts. If a paramedic looks at the paperwork and sees the first lab test was 0.1, but a second test a few hours later jumped to 2.5, they know the heart damage is actively getting worse. They can anticipate that the patient might suddenly become unstable during the long drive. 2. Guarding the pump. When heart muscle cells are damaged, the heart struggles to pump blood efficiently. Paramedics use the troponin values to gauge how fragile the patient's heart is. If the numbers are sky high, they will proactively set up advanced medications to manage blood pressure and keep the heart from working too hard. 3. Watching for short circuits. The heart runs on its own built-in electrical grid. When heart cells die off due to lack of oxygen, they can stop conducting electricity properly. High troponin levels warn the paramedic to keep a laser-focused eye on the cardiac monitor because the patient is at a much higher risk for dangerous, chaotic heart rhythms during the trip. The big picture. For a transport paramedic, a troponin value isn't just a random number on a lab sheet. It is a real-time damage report that tells them exactly how much trouble the heart is in, allowing them to protect the patient until they reach the specialist hospital.